My name is Rachel, and I conducted my studies on Dr. Bridget A. Taylor. In this presentation, we will learn about who Dr. Taylor is, what articles I found in gathering my research, what I would ask if I could interview Dr. Taylor, why her work is important, and how does her work relate to our class. So who is Dr. Taylor? Dr. Taylor is a board-certified behavior analyst with a doctorate degree that she earned in 1996, and she's also a licensed psychologist. She is the founder and active CEO of Alpine Learning Group, which she founded in 1988, and she currently serves as a senior clinical advisor for Rethink Autism, as well as she serves on the board for the Society of Experimental Analysis of Behavior. In the past, she has served as president of the BACB, and also the associate editor for the Journal of Applied Behavior Analysis. In her career, she has published more than 40 peer-reviewed articles on various concepts in ABA, and she has specialized her work in improving the lives of individuals with autism. Here are the 5 articles that I found when gathering my research. The first article was published in 1995, and it addresses a study that Dr. Taylor conducted to teach children with autism to seek novel information and generalize their responses. Taylor explained that while typically developing children tend to acquire these skills pretty early on in their development, children with autism tend to lack this skill, but they can be taught it. The second article was published in 1998, and it addresses a study that she conducted to teach a child with autism to initiate verbal conversations in social contexts, and she did so through the use of a tactile prompt that she named the Gentle Reminder. While she determined that this was an effective and relatively unobtrusive prompt, she explained that further research would need to be conducted to determine how to fade that prompt and transfer stimulus control to natural cues. Both of those articles discuss ways in which children with autism can be taught to socially engage through language, which is a common skill deficit for children on the spectrum. The third article was published in 2005. This was the only article I read that focused on behavior reduction rather than skill acquisition. However, it does provide some valuable insights. In the article, we learned that Dr. Taylor conducted a study on a child with autism who engaged in vocal stereotypy, and through experimental analysis, she determined that a DRO was more effective in reducing this behavior than was a fixed time schedule of reinforcement. The fourth article was published in 2008, and it focuses on a study that Dr. Taylor conducted to teach children with autism to initiate bids for joint attention. She explained that children with autism struggle with more complex tasks associated with joint attention, like initiating bids and shifting their eye gaze between stimuli and people. The fifth article was published in 2012, and it discusses the importance of promoting observational learning skills in children with autism. In the article, she provides teachers and other professionals with various strategies and tools for teaching observational learning skills to children with autism who may lack various components like attending, imitating, and discriminating auditory stimuli. Both of these articles place an importance on teaching children with autism various learning-based skills that will allow them to acquire more complex skills in the future. If I were given the chance to interview Dr. Taylor, here are some of the questions that I would ask her. The first question is, what sparked your interest in ABA? The second question is, what advice would you give an RBT who's just starting their ABA studies? The third is, what other areas of ABA would you research if you could? The fourth is, do you have a favorite behavior analysis researcher? And the fifth is, what changes do you think should be made to the field of ABA in the next 20 to 30 years? Dr. Taylor's work is important for many reasons. Through research and the application of behavior analytic principles, Dr. Taylor has shown that ABA can be an effective treatment for a multitude of behavior reduction and skill acquisition needs for people on the autism spectrum. While ABA is not just used to treat autism, Dr. Taylor has shown that it can greatly improve the lives of people on the spectrum when implemented effectively. Additionally, Dr. Taylor's research has contributed greatly to our understanding of skill acquisition for children with autism. Through her studies conducted with actual children on the spectrum, we have learned about the variety of skill deficits that people with autism can have, as well as taken a closer look into the methods and procedures that can be utilized to improve these deficits. While I did not choose to read many articles on behavior reduction, Dr. Taylor has done significant research regarding behavior reduction and behavior change in children with autism. When we look at Dr. Taylor's work as a whole, it's important to note that she expanded beyond skill acquisition and focused on other aspects of autism that ABA can serve. Lastly, Dr. Taylor has always placed an importance on taking scientific approaches when conducting behavior analysis research. She serves as a role model for behavior analysts to embrace the scientific and evidence-based aspects of ABA in order to further advance our knowledge in this field. Dr. Taylor's work relates to our class in a couple of ways. As I just mentioned, she always takes a scientific approach to her research, which is a very important aspect of ABA that we learned early on in this class. Additionally, she explores various concepts that we have already discussed or will discuss, including but not limited to differential reinforcement, reinforcement schedules, and behavior reduction. And she applies these concepts in studies with real people who are in need of ABA interventions. Overall, I learned that Dr. Taylor has made extensive contributions to the field of ABA in a variety of ways, including conducting research, taking on leadership roles, and creating her own ABA company that provides services at the individual level. Dr. Taylor is an inspirational professional, and I hope to make contributions as important as hers someday.